Hello, this is Dr. Gay from First Look MRI, and this is a 51-year-old female who twisted her thumb. She's got pain at the base of the thumb, and they wanted to evaluate for a ligament injury. So on this view, to get our anatomy down, we have the first metacarpal bone here in the hand. We have gray material over here. This is a muscle. We have the proximal phalanx of the thumb here, and this is the distal phalanx. We have an interphalangeal joint, and again, this is the metacarpophalangeal joint, the MCP. Now this is the main thing we look at, and we look at a couple ligaments when people have twisting injuries. In addition to the flexor and extensor tendons that make the thumb bend and extend, or flex and extend, we also look at this on the outside called the radial collateral ligament. This will hold together these two bones, and this radial collateral ligament looks intact. Now this is a different view where fluid is bright and bones are dark, and we see here this radial collateral ligament is much better defined. Now we can see this dark band joining the first metacarpal head to the base of the proximal phalanx. Nice dark radial collateral ligaments intact. There's some brightness in the bone here. This is a bone injury, a bone contusion or stress injury, but the radial collateral ligament is intact. Now we want to see something very similar on this side. This is the ulnar side. We want to see the ulnar collateral ligament, but you can note here that we don't see it. There's no well-defined dark band over here. So the ulnar collateral ligament is completely torn, it's ruptured, and we're going to look for it here. We do see a little horizontal band right here. This is the ulnar collateral ligament. It's torn from the attachment here, folded down about 90 degrees, and then now it's poking out horizontally instead of longitudinally. And there's an ill-defined band here. This is called the adductor aponeurosis. So the muscles here in the thenar region, some of the muscles will come out here and they'll form a broad band, a fibrotic band called the aponeurosis, like a ligamentous attachment, and it attaches here to the base of the thumb on the ulnar side, and that is partially torn and stripped. It's kind of ill-defined and foggy, but we can see some of the tissues here. It's a very thin structure, kind of hard to see anyway, but I do see this as part of the adductor aponeurosis. It's partially torn, and the main thing to note here is that this ulnar collateral ligament that wants to attach here is rotated down by 90 degrees, and this is in the way, so this cannot fold back up to heal. So this is an indication for surgery. We call this a Stener lesion, when this ulnar collateral ligament is ruptured and folded down, and this adductor aponeurosis is interposed, it's in the way, and this cannot fold back to heal. So they have to go in there and do surgery, move this out of the way, and put this back underneath it so it can heal. So this is an example of a Stener lesion, which is a ruptured ulnar collateral ligament, and this adductor aponeurosis is in the way, and this cannot heal the way it is, so they do need surgery. Again, the radial collateral ligament on this side is intact, and they do have this bone injury. Thank you very much.